today. May I confirm that you are Mrs. Sally Webster, 44-year-old?
Yes, doctor, I am.
We are here together to discuss your condition. It's okay with you.
Yes, doctor, okay.
I will write some notes and it will be totally confidential. It's okay with you.
Okay.
Can you tell me, please, what bring you today to hospital?
I have this awareness of heartbeats, doctor. It's about 3 months now. I feel, it's come and go. Sometimes I feel like my heart is so racing, and sometimes it's okay. And it's affecting me a lot now. Even in sometimes it happens when I am in at work, and um, I need to to leave.
Sorry for that. We are here to help you and solve any concern that you have. Um, you said this on off the racing heartbeat.
Yes, it comes sometimes, like in attacks.
Mhm. And it was regular.
Yes, doctor, really.
Okay. And it's preceding by anything that like exercise or anxiety.
I don't know, doctors. Yani sometimes it's when I do something, sometimes when I'm just watching TV, sometimes it's not always.
And you did anything to relieve this symptoms?
No, actually, I don't know what to do.
Okay, it's this first time that from 3 months it's affected. There is no previous attack.
Yes, doctor.
And it's happened at night when you are sleeping.
Yeah, sometimes it happened once.
Okay. Do you have any chest pain?
Uh, no, doctor.
Any difficulty of breathing?
No.
Do you feel any dizziness after this attack?
No.
Do you have any dizziness when you get up from sitting to standing?
No.
Any legs swelling?
Any what?
Legs swelling.
Leg? Leg? No, no,
Okay. Do you have any headache?
no.
Any flushing or episodes of anxiety?
Sometimes I feel like, irritable, like irritability, doctor. Especially with this, when this beats racing, I feel like so nervous, so irritable.
Okay. Any flushing?
No.
Any shaking of your hand?
Yes, sometimes, yes, it happens when I get this in the attack also, when I get this heart racing.
Okay. Any change in your weight?
Mm, no,
Okay. Any change in your appetite?
no,
Any weather preferences?
no,
Any loose motion?
no,
Do you have any skin rash?
no,
Lumps or bumps?
no,
Any joint pain?
no,
Anyone that told you that you are become paler?
no,
Okay. Do you have any cough?
no,
Any coughing of blood?
no,
Okay. Any history of fever?
no, doctor,
Any night sweating?
no.
And it's come to my knowledge that you have high blood pressure and high blood sugar.
Yes, doctor, I am.
Can you tell me when high blood pressure this diagnosed?
Well, I have this high blood sugar, doctor, for 5 years now, and my high blood pressure for 1 year.
And it's controlled, the blood pressure and blood sugar.
Well, my blood sugar, yes, controlled. It's about I'm on glucophage, but it was controlled recently. I feel like it's sometimes I have this reading high, and even my blood pressure it was controlled, but for 3 months now it's uncontrolled.
Okay. So what you use glucophage for high blood sugar and any other medication,
No, just glucophage.
and for hypertension, for high blood pressure.
Atenolol.
Any change in the dose for this medication? Recent change before this?
No,
Okay.
no,
Uh, okay. Then atenolol since 1 year also, right?
yes,
Do you have any history of a stroke or mini stroke before?
no,
Any frothy urine?
no,
Okay. Any blurry vision?
no.
Any change in your water work amount?
Now, no, but 1 year ago it was like increasing. I have experienced like increasing in my water work, but now it's okay.
Okay. Do you have any tummy pain?
Uh, well, no, doctor, no.
Any passage of a stone with water work?
No,
Okay. Any family history of similar attack for this racing heartbeat?
no, doctor.
Any history of DM or hypertension in diabetic or hypertension in family?
High blood sugar, high blood pressure, no,
Okay. Any chronic disease or gland disease should I aware about it in family?
no, doctor,
Okay. Do you have any pigmentation,
no,
skin pigmentation? Okay.
no.
Did you do any surgery before?
Yes, doctor, I did surgery before 1 year ago in my
For
neck.
what? Oh.
They told
Uh,
me that I have like a swelling in my neck, and they told me that I need to remove it.
okay. So then you did any you take any medication for this?
No, no,
Okay. And do you have any numbness or tingling in your hand or feet?
no,
Any abnormal movement?
no.
Any stiffness?
Sometimes there's a thickness in my hand. No, no stiffness.
Weakness in your hand?
No, doctor.
Okay. May I ask you, please? Sorry for this question. Do you take any illicit medication, recreational medication?
No, doctor. No.
Any? Do you smoke?
No, doctor.
Do you drink alcohol?
Yes.
For how much?
It's not over the limit, doctor.
Okay. And do you drink too much coffee or caffeine?
No, no.
Okay. What about your period? It's a
6 minutes.
regular or
6 minutes remaining. My period is regular, doctor. Yes.
okay. Are you married?
No, doctor.
Do you have any partner?
No,
Do you use any oral contraceptive pill?
no.
Okay. What do you do for working?
I'm a bank teller.
What?
I work in a bank.
Okay. Did this affect your job? You told me, right?
Yes, yes, doctor. A lot.
Okay. I will refer you for the occupational health worker to help you. May I examine you?
Okay, doctor.
Okay, I will check the blood pressure,
Okay, the blood pressure is normal. Sorry, 150 over 90.
heart rate.
100 regular, 100 beat per minute, regular, average volume equal on both sides.
Okay, checking hand or sweating in the hand.
Yes, there is sweating.
Tremor.
Slight trend.
Okay, then I will check eye for this any pallor or jaundice.
Can see it negative. No, no bother, no jaundice.
Okay, for the neck, I want to examine the thyroid. Uh,
Here is an
there's scar. Okay, and if there is palpable nodule.
no, no nodule.
Okay, then I want to check the heart sound. If there is
The
any
heart
murmur.
sound. No, you can hear S1, S2, and normal.
Okay, then I want to check the abdomen for any organomegaly or masses.
Okay, before you check the abdomen, would you ask here for anything?
Do you have any pain in your tummy?
No, doctor, I don't. And
Okay.
lying flat, then you check. Okay.
Okay.
Uh, there is no organomegaly.
Okay. Any lower limbus edema?
No, negative.
Okay. Do you travel recently, Mrs. Sally?
No, doctor.
Okay. May I know what's your concern?
What I have, doctor? What's wrong with me?
I appreciate your concern. We need to do some lab tests and imaging to confirm our diagnosis, but most likely you have a condition called pheochromocytoma. Don't bother yourself with this medical term. This means that you have some proteins that's overproduction of hormones from the gland that located above the kidney. Do you have any other concern?
Yes, doctor. Is it related to my surgery?
It's a multi condition that may have it's a condition contain a lot of problem in the many glands. One of them of the thyroid gland, that's a gland in front of your neck, and also to the gland above your kidney. So it's connected with each other.
Okay. So is it serious?
I'm sorry to tell you that. Yes, it's serious if not treated. So what we will do, we will refer you to the multidisciplinary team. And first of all, I want to advise you to stop this medication, atenolol, for this hypertension. We will change it, um, and we will do some lab test and urine test. Do you have any other concern at this time?
No, doctor.
Okay, thank you.
Well, you still have 1 minute and 30 seconds.
1 minute.
Yes.
I
Anything you
think.
want to check or ask?
mm, mm. Do you have any episodes of low blood sugar?
No, doctor.
Okay, I think I don't have anything else to ask about.
Okay. Okay. So still you have 30 seconds. Okay. So can you present your finding, Dr. Sarah?
Mrs. Sally Webster, she is 44 year old lady. She has complained of palpitation since 3 months. episodes of palpitation, on off, and it's not associated with exercise or rest. Also, she has anxiety, irritability, shaking of hand, and episodes of sweating. She is known case of DM and hypertension. It was controlled, but in the uh, last um, last 3 months, it was not controlled. She is on atenolol and metformin. She has a history of thyroidectomy, and on examination, she is tachycardic, regular, blood pressure 150 over 90. She has sweating and tremor, fine tremor in her hand, um, a scar in front of her neck. Uh, reg- um, the heart is no murmur in heart. This one is to no murmur. Abdomen soft, lax, not tender, no organomegaly, and no lower limb edema.
Okay. So what will be your differential?
My top differential diagnosis is MIN1. That's include pheochromocytoma and sorry, yes, MIN2, pheochromocytoma and medullary thyroid cancer.
Okay.
And it could be pheochromocytoma alone.
Okay.
Okay.
So any other differential?
It could be thyrotoxicosis.
Mm-hmm. Anything else? Okay. So what is your differential for this scar?
This scar for thyroidectomy.
Okay. Did you ask her why she did the scar, the surgery? She told you about the swelling.
Oh no.
Okay. What if I told you that she was complaining of constipation and polyuria and headache for about 1 year now? And after this, she did the surgery for it.
Parathyroidectomy.
Okay. So it can be explained by any of your differential.
Yeah, min one, not min two.
Okay. So how are you going to manage this patient?
First of all, apart from a basic lab, full blood count, and kidney function test, electrolyte. Um, I will send for this patient to confirm our diagnosis. Urine and serum catecholamine, and also I will send for her calcium level, phosphorus. I will do also ECG, echo, ECG to rule out any cardiac cause, and echo. I will do for her hemoglobin A1C also, fasting blood sugar. Uh, um, Thyroid function test,
Okay.
I told. Thyroid function test, also neck ultrasound, and adrenal CT. I think adrenal CT.
Okay. So what are you going to treat this patient?
Non-pharmacological patient educational and counseling, um, psychosocial support, occupational health support, and uh, I will a multidisciplinary team that include endocrine and surgery, and I will stop to the atenolol. We will start here in alpha blocker for 2 weeks.
Time up.
Then beta blocker.
Okay. Thank you. Okay, Dr. Sarah. What do you think?
Oh, I think I missed this neck scar. I think it's thyroidectomy.
You guess it. Okay, but you already you pick it up. I mean, you catch it in when the examiner try to, you know, prompt you. So you did it nicely, Dr. Sarah. I mean, um, you always, you know, I like your way that you are systematic. I mean, I like to be like this way, to be more systematic. It even make it easy for me when I correct for you. Okay, so yes, it's a case of mentor. Your
Mm,
communication was, let me comment for you. Your communication was very nice. I mean, you check about the palpitation itself. Is it regular? Is it irregular? Is it fast? Is it slow? And then ask about duration, onset, course, any previous attacks before. You analyze the palpitation itself is very nice. And then go cover cardiopulmonary and very nice ask about the disease. This is the alarming here. The most important to ask about the collapse. Okay, so you did nicely. Then you start to check about whether blood sugar, about sweating, tremor, irritability, cover all the endocrine, the triple three, the pheochromocytoma, the cytotoxicosis, and hypoglycemia. And also ask me about the flushing for postmenopausal or for a carcinoma. Okay, so you cover it nicely. Just what you missed in your history about the when you asked me about the PDF, the surgery, you didn't check why she did this surgery. I mean,
mm,
what were you know, when I did surgery? Okay, what why you did it? What were your complaints at that time? If you ask me, I will tell you about the constipation, the headache, the polyuria for 1 year. And after this, I do what the surgery for this next week. Okay?
mm,
This is for the communication. So for me, you did it nicely. I don't have any problem with communication. Just, oh, yes. Also, when you ask me about what the alcohol, what about the limit? Here, the palpitation issue, we have very important causes, alcohol intoxication or alcohol withdrawal. So you need to ask me, what about the weekend? Do you drink more? What about the last days? Any change or you stop the alcohol? Why? Because sometimes maybe your case, alcohol withdrawal or alcohol toxicity. Okay? The ones
mhm,
appearing basis before alcohol toxicity. Okay? So when you catch it, the alcohol here, ask about all. You ask me about the family history, illicit drugs, but the family history here, cardiac, Dr. Saur. Once you cardiac, please don't forget any family history of heart problem, any family history of sudden death,
mm,
okay? Because it could be a case of arrhythmia, for instance. This palpitation, just he will tell you about the sudden death, and you may tell this is maybe arrhythmia, okay?
mm,
So this is your communication. Just comment for you, but for me it's good. You even ask about the pulse or the fever. For me, not nothing in your communication. Your examination also, the general examination, very nice. You check the hand, you check just you know, we check also the elbow, IV marks, because could be related to illicit medication and he deny, or this a case of infective endocarditis. So check the
mhm,
elbow, okay, those systematic organs. The eye, you examine it, the mouth for pigmentation. The neck, you check for the scar, and you ask for nodule. Why you didn't examine for goiter? I mean, why you didn't ask her to drink some water and swallow? Why you
mm,
didn't check there is goiter or no? And if it's goiter and you suspect him into medullary carcinoma, why you didn't examine the lymph node? Here, the lymph node is very crucial. Okay, so you miss
mm,
it. Rather than this, you did nicely. The pulse okay, the heart okay. You examine the abdomen, you did it nicely. Just you miss the lymph node, and here
okay,
is will affect you. Why? Because your case is into medullary thyroid carcinoma. Okay,
mhm,
so your examination just to cut 1 month for the lymph node question. Your physical finding presentation was nice. Just you tell me this is a thyroidectomy scar. You know, you were sure this is a thyroidectomy scar. It's not. But other than this, You tell me all the physical finding, except you miss the symptoms of hypercalcemia because you didn't ask about it. Okay? And I
Mm,
don't know, you asked me about the water work, I told you about the polyurine. When you ask about hard loose stool, just complete it, loose stool, hard stool, you know. You ask me any loose stool? No. Any hard stool? Yes. If you will just, you know. So if you ask about the stool, ask hard or loose. You may catch it. But your physical
mm,
finding, no problem. Your differential also was nice. Pheochromocytoma, maybe alone or maybe min 2. Okay, min 2, what is min 2? It's medullary carcinoma and the hyperparathyroidism. It's present. Okay,
mm,
min
mm,
1 is the 3B, parathyroid, pituitary, pancreas. This is min 1. Min 2, hyperparathyroidism, pheochromocytoma, and medullary thyroid carcinoma. Okay, so parathyroid here present also. Then the other differential could be thyrotoxicosis. If you wanted to say it could be hypoglycemia, panic attack. This is if your differential. So for me, your differential also is good. Let's go for the judgment. Investigation. You asked me about hemoglobin A1C. Okay. Catecholamine. It's called metanephrine and normetanephrine. No catecholamine. Okay.
متذكرة أها.
There is no name of catecholamine. We called it normetanephrine and metanephrine. Before it, we called the vinyl mandelic acid, but it's not. No, no. Recently, I mean, when you tell me, we'll search for metanephrine, normetanephrine in blood and urine. Okay. You
Okay.
search for the calcium. You search for thyroid. But what about the calcitonin?
Mm,
This is not thyroid. This is medullary carcinoma. So you didn't check for the calcitonin. Okay. Rather than this, you did it the other. Then you tell me ECG and echo. Why echo here?
To rule out any valvular heart disease.
Mm, okay, so you need to rule out any valvular heart disease in this patient, or you have explanation for the palpitation.
يعني if sometimes if there is any yeah, palpitation, there is valvular heart disease like mitral stenosis or
So any
no.
palpitation to do for hair echo,
I'm not
or you
sure
can just the murmur.
if there is
Okay,
murmur.
yeah. If there is murmur, we do echo. If you find
Okay.
anything, suppose you why? Because the echo is something will cost the NHS, and you need to take appointment for it.
Mm,
So not tell him to do ECG and echo. No, you tell him ECG, and if we need it, we may do echo if we need it. Okay. So here it's not the if we need it. If we found
okay.
like a ECG, whatever. Okay. Just, but it doesn't affect you. You miss the calcitonin. This will affect. I will just cut one. The treatment, you did it nicely. You stop atenolol. This is very crucial here because it will exacerbate her hypertension. And you tell me about the surgery, but just don't say non-pharmacological and pharmacological. Just patient education and counseling regarding his medication. If he need the occupational support, social support, then the multidisciplinary team, the endocrine surgeon, he will need surgery. We'll give him alpha and beta blocker. Okay,
Okay.
so I'll just cut one mark because you missed this calcitonin issue. And by the way, you need to do calcitonin even if you don't found anything. I mean, if you don't found a jewel, if you don't found lymph node, we need to screen for calcitonin. Okay, so
Okay.
this is here mandatory. Your concern also was nice. You did it nicely. I don't have any problem in the concern. So I will just cut one mark in the judgment. I cut one mark in the examination. Just. So it's 26 out of 28, Dr. Nusar.
Mm. I hope like this in exam also.
Inshallah.
Or more full mark.
Inshallah. You know, if it's not a rare case, so you will do it very nice. Okay. Once you are organized, you will feel it's okay. But the problem is that sometimes because they present rare cases, uncommon cases, um, that here you may face, trouble. but inshallah you will pass this time. Okay.
Inshallah.
Okay. So any questions regarding this case?
No, thank you.
Okay, Dr. Niha, Dr. Abdullah.
No issues, no.
Okay, I hope it's clear. Dr. Niha, okay? Oh, okay. I don't know, Dr. Niha, where? Okay, so just I will revise with you
Yes,
the clear for you, Dr. Niha? Okay. Any question?
yes, ma'am. Yes, ma'am.
Okay. Sorry, I feel you what is time? What is time now for you?
Ma'am, it's 1 o'clock.
Ah, okay. That's why you are sleeping. Okay, sorry
No,
for
ma'am,
that.
I'm drowsy, but I'm not sleeping. I'm
Why you
trying
are
to
drowsy?
focus.
Okay, okay. So, I don't know. Just I will finish it and we just, discuss the data and times together. Okay. Just I will revise with usable palpitation issue. Dr. Sarah, if you want, just we will play the game. Okay. Ready with me?
What, doctor?
Let's play our game. We revise a palpitation. I will just tell
Mhm.
you and use me, okay? We have this palpitation. We verify it. It's regular or irregular. Why? Because irregular sometimes maybe the case is AF. The
Mhm.
issue is AF, and so you search for embolic manifestation, stroke, and whatever. And then it's regular. When we irregular, like you did, we ask about cardiology first. Okay, what could be what we are searching when we search cardio? If I told you that would I have this heart racing, doctor, then you tell me, I tell you that I have shortness of breath, I have
Mhm.
chest pain, I have cough. So what it could be?
Pulmonary embolism.
Okay, pulmonary embolism. So I will search for other thrombophilic. I mean, if I told you I have long haul travel, if I told you that I have this oral ulcer, genital ulcer, what else? You are searching if it's pulmonary embolism.
Skin rash. Also history of abortion. Using of oral contraceptive pill.
Nice.
Uh,
Okay.
uh, DVT يعني lower limb unilateral lower limb swelling.
Okay.
Family history of clotting disease.
Yes. And valor, lumps, bumps, because it could be BNH,
Pumps. Mhm.
any valor, any change in the color of your urine, or any lumps, bumps, because it could be lymphoma, lymphoproliferative disease. Okay. So I
Mhm.
ask about any family history, any past history of clothes, any leg swelling. What about any long haul travel? Then I am searching for the rheumatology and the hematology. Any pallor, any change in the color of your urine, especially at morning. Then any lumps, bumps, any rash, any joint pain, any rash and sun exposure. What about any oral ulcer, any genital ulcer, any what about any history of abortion? Okay, for antiphospholipid, all of them. This is the thrombophilic risk factor. Well, I have this cough, doctor, and I have shortness of breath, chest pain, but I don't have any of these.
Cough, shortness of breath.
Yes, I have cough, shortness of breath, chest pain, and I don't have any of the thrombophilic risk factor.
Maybe heart failure.
Okay, heart failure. So what do you want to ask me?
Lower limb swelling.
Okay, no.
Orthopney. Did you walk at night to search about air?
Yes, BND, no.
Mhm. This shortness of breath is decreased when you take a rest.
Um, yes, maybe. Yes, exertion. Yes.
Mm. Any fever?
So you asked about heart failure. Okay, no.
Okay, I think pneumonia or something in chest.
Mm,
Any
no.
infective endocarditis?
Infective
No.
endocarditis would be fever. I don't have fever.
Mm, mm. Oh, I don't know.
Okay, so you need. Do you have any? I mean, cough, shortness, or chest pain. So it's a cardiac patient, right? Mostly, I
Yes,
mean, cardiopulmonary mostly, right? So you are
yes.
searching for what? It could be pulmonary embolism. No, it's not pulmonary embolism. So I need to search for the cardio. Could be this a Hawking patient? Yes. So I need to ask
Yeah,
for the
yeah.
family history, if sudden death of cardiac or not, and I need to examine the patient. Could be this a case of Hawking. Okay.
Mm,
What about other? What about this patient, for instance? If I give you this patient, this patient, and he has this palpitation, he has shortness of breath, chest pain, doctor.
Marfan, maybe pneumothorax or
Marfan, I'm complaining of palpitation,
mhm, uh,
not
aortic dissection,
palpitation, palpitation,
aortic regurg.
aortic regurg, thank you, or mitral regurg,
Mm,
mitral valve collapse or aortic regurg, mitral regurg, all of them you can find in Marfan patient. Okay.
mm,
And once you have mitral regurg, aortic regurg, and Marfan patient, or whatever any patient, please don't forget infective endocarditis. So ask
mm,
about the fever and could be just infected. And it's a common case. Marfan patient, he has chest pain or palpitation. Then you will just, examine, oh, this is aortic regurg. He is having mitral regurg. This is my case. No, he just has dental procedures and he has fever. So your
mm.
case is infective endocarditis. Okay. So it could be HOCM, as we said, could be mitral regurg, aortic regurg, or infective endocarditis. Well, no, I have shortness of breath, I have chest pain, doctor, I have palpitation, no thrombophilic risk factor, and no, you examine me, no valve lesion, no HOCM, no mitral regurg, no aortic regurg.
Mm, QT prolonged QT.
Thank you, arrhythmia. So
Mm,
the last thing is to ask about what's the arrhythmia. So don't forget also the family history. Mostly he may give you the family history of sudden death or cardiac disease or whatever. Okay?
mhm.
Okay. So I have this palpitation, doctor. I have shortness of breath, chest pain, and I don't have any thrombolytic risk factor. I don't have any family history. I don't have any when you examine me, there is no valve lesion, no fever. So what is the next step?
I will ask about other endocrine.
Mm. Endocrine will cause shortness of breath, chest pain. Before the endocrine. What is the similar like cardiopulmonary? It causing awareness of heartbeat, chest pain, shortness of breath, anemia.
Anemia. Anemia.
Yes, anemia, pallor. So ask about pallor. Could be this is a case of anemia. I mean, this patient appeared also before. Let me see it for you. This patient, she had palpitation. Okay.
Mm.
And she, if you ask her, she will tell you about I have shortness of breath, chest pain, no cough, doctor, and I have this pallor. They told me, and you notice this rash on her leg.
This is what telangiectasia or what? Or
No, this
ecchymosis.
is bruises.
Ecchymosis.
Yes,
Sorry.
ecchymosis.
Yeah, yeah.
Okay.
Maybe she used
Yes.
any يعني anticoagulant medication.
Thank you. So you are searching for bleeding, any cause
Mm.
of bleeding, maybe anticoagulant, any family history of bleeding, is any history of trauma, whatever. What what I say? Yes, any personal history of bleeding. Okay. No, I
Mhm.
don't have them, doctor, but I have joint pain sometimes.
Maybe. Yeah.
She will tell you, I have the joint pain, doctor. What do you mean by joint pain? Sometimes I feel, when I move something, I have lax, my joint is lax and I get painful. I feel it's painful sometimes.
Marfan?
No?
Ehlers-Danlos
Yes.
syndrome.
Yes, thank you, Dr. Neil.
Mm,
Ehlers-Danlos. This is a case of Ehlers-Danlos. Appeared before and even in past recently, I think. Maybe palpitation because of anemia or because of mitral regurg. Okay, so this is a case of Ehlers-Danlos. He will tell you that I have palpitation, I have joint pain, and just the joint pain, if you analyze it, it will be laxity, and then you will find this is palpitation because bleeding, like in case Dr. Sarah, like pseudoxanthoma elasticum, all of the
mm,
connective
mm.
tissue disease, elasticity, some rashes, and bleeding, whatever he is bleeding from on any side. Okay, so this
Okay.
is Ehlers-Danlos syndrome. Okay, and this is what we call the money paper sign. It's also from the skin manifestation. Okay, so
Okay.
I finish. I ask palpitation. If he tell me shortness of breath, chest pain, cough. So once I hear shortness with chest and the cough. So cardiopulmonary mostly. I'm in cardiopulmonary. No, it's shortness of breath and the chest pain only. So could be cardiopulmonary, could be what? Could be bile or anemia. I'm searching for anemia. There is bleeding tendency, like we said. Okay. No, it's no. There is no bleeding history, no Ehlers-Danlos, nothing. So there is no bleeding. So what could be other causes of anemia I'm searching for? Could be iron deficiency anemia. So ask about any non-steroidal. What about could be celiac, could be B12. I mean, this is your case of anemia now. So we need
Mm,
to search for all the causes of anemia. Maybe because of bleeding, yes. Maybe other. Maybe this is a case of celiac disease and just anemia and hypocalcemia with palpitation, whatever. Okay. So don't be
okay.
blocked by just one. I mean, I search for bleeding, no bleeding. So now I am not. I don't know. No, take the approach of anemia. Okay.
Okay.
Okay. Now, no, there is no anemia, no valor doctor, and no thrombophilic risk factor of pulmonary, and you examine the heart, no valve, no family history of cardiac disease, no fever. So now you are going for
Endocrine?
endocrine. Thank you. Could be with shortness of breath and chest pain. Yes, could be, but
Mm,
not common. But could be. Yes. So what is the mostly when I asking about endocrine, I'm searching for what?
Thyrotoxicosis?
Yes, ask
Mm,
about two things, sweating and tremors. They will
mm,
guide you. I mean, if you have palpitation, sweating, and tremors, this triple is equal triple. Thyrotoxicosis, FeO, and hypo. Okay?
mm.
So any low blood sugar? Yes, doctor. So this is hypoglycemia. Well, what about any weight change? What about your period? What about loose motion? Any loose motion? So I'm asking for any user preference. This is thyrotoxicosis. Okay. I don't found in the thyrotoxicosis, I don't found hypoglycemia, so it could be pheochromocytoma. Just as a patient have hypertension uncontrolled, blood sugar uncontrolled, he has panic attacks and anxiety, all of this. Okay.
Okay.
Okay. Once I tell you that I have user preference, doctor, and I have my period is I have amenorrhea and I have loose history. So what is next? This is a case of thyrotoxicosis, right?
But,
Once
mm,
you found thyrotoxicosis, what you will search
search
for?
for other autoimmune.
Thank you. For other autoimmune. Like what?
Celiac, DM, Addison,
Celiac
Addison.
disease, Addison, diabetes, B12 deficiency, other connective tissue disease, premature ovarian failure, myasthenia gravis, or autoimmune. Okay?
Okay.
Okay. Okay. I have this palpitation, Dr. Sarah. I have sweating tremors, and I have skin lesion. on my skin, like this patient. Yes, this patient.
tuberous sclerosis.
No, she has also this and this. Thank you. Yes, neurofibroma. So I may have a skin lesion, doctor, and I have this fibrocytoma. Once you have the fibrocytoma in the exam, search for others that include fibrocytoma, like neurofibroma, like our case today, MEN2, like neurofibroma. Okay, I don't have any skin lesion, doctor, but my father died of kidney disease.
kidney
Yes.
polycystic
What?
polycystic kidney disease.
Oh, I have fibrocytoma, and my father has history of kidney. He died of kidney
Uh,
cancer.
von Hebel.
Yes, thank you. Won't happen in that. Okay, won't happen in that. So, when you have this fibrocytoma in the exam, could be mean to, like we said, mean to A, could be von Hippel-Lindau, could be neurofibromatosis. Okay, could be tuberous sclerosis, yes, but it doesn't come in basis before, but it could be yes. Okay, so I have kidney problem, von Hippel-Lindau. I have a skin lesion, doctor. It could be this neurofibroma. Others will be adenomyosis of the tuberous sclerosis. He will have a low IQ. Okay, he has gum hypertrophy because of phenytoin. If he has seizure, he has other skin manifestation. Okay, if he has axillary freckling, if he has coffee ole patches, if he has this neurofibroma. Okay, so this is a case of neurofibroma. Okay. So this is if I have sweating and the tremors. Okay, I still have sweating tremors, doctor, and they come in attack with my palpitation. But you ask about thyroid failure, hypoglycemia, nothing.
panic attack.
It's okay, but the panic attack or an anxiety, it is the last thing to go. What? What, Dr.
Ma'am,
Nina?
electrolytes, potassium
Electrolytes?
level,
No, no, not basis wise. No,
temperature,
something.
fever.
No, no fever. We excluded fever, no fever. I have just a sweating, tremors, palpitation, and you ask me about thyroid, fail, hypo, nothing. But when you ask me, if you
Ma'am,
ask me about
coffee
the
intake,
periods,
coffee
what?
intake, caffeine,
No. Yes, even no, anxiety, coffee, tea, family history. These are things, illicit drugs. These you would ask for anything. I mean, your case is still not solved. Could be including others. I mean, you may face a case, family history of sudden death arrhythmia, and the patient is taking caffeine. He is in stress, like our patient. Okay, so yes, these are causes, but don't search it for the from the beginning. I need to go for others before it. If I told you that, well, my period now, I have like 1 year. I don't have period for 1 year.
Pregnancy.
postmenopause,
Postmenopausal,
premenopausal.
yes,
Premenopausal.
perimenopausal or postmenopausal symptoms. So come before, yes, come before. So take care. Sweating, tremors, endocrine. So search about thyroid, fail, hypoglycemia. You don't find anything, ask about period. Well, doctor, I have lost my period now for 1 year. Okay, I ask her about period, it's normal, but still there is this palpitation. And she tell me that she have sometimes tremors. The one you asked me for it, Dr. Sarah, flushing. Flushing will be in postmenopausal. Okay, what else? If it's not postmenopausal, was flushing.
Carcinoid.
Carcinoid. Yes,
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 carcinoma.
carcinoid. Yes, carcinoma. Okay. So asking about, I ask about palpitation, irregular, then go cardiopulmonary, nothing. I go for valor nothing. I go for splitting tremors to search for other endocrine thyroid pheo hypo. Nothing. Go for boosting mucosa and carcinoma. Okay, if you don't find any of them, I will go for what? For the PDF, any anxiety, caffeine, tea, illicit drugs, any family history, any cardiac case you face in basis, you need to ask any family history of heart disease, any family history of sudden death. Okay. Okay, what is significant? I mean, the family history that I can consider it's significant in heart. If you tell me that my mom has heart attack, doctor, when he is 60 years old, is it significant?
Not significant.
Yes.
For
So the
female, I
positive,
think 50. No. Okay.
yes, it's for males less than 55,
Mm.
females less than 65. So if female is 60, it's okay. It's not. It's positive to have. Okay, so expect it to be less in more in female. Okay. So if he has her father has this ischemia or heart attack when he's 60, this is not significant. This is not a positive family history. Okay, but her mother is having heart attack 60. Okay, okay,
Okay.
clear. Or she has relative sudden death. Any two or more relatives on same side of the family sudden death. But basis wise, any history of sudden death. I mean, if she has her brother died suddenly, sudden death. If her mother died sudden death, it's positive. Okay, so positive family history, heart attacks, if it's more than 55, less than 55 in males, less than 65 in female, or family history of sudden death. Okay,
Okay.
okay. If I ask all of them and there is nothing, what else should I ask? What is remaining now? I ask about cardiopulmonary. I ask about pallor, fever. I ask about endocrine. I ask about anxiety, caffeine, tea, illicit drugs, family history. Nothing. So what could be?
Alcohol.
Alcohol. Okay, thank you. Alcohol, as we said, alcohol. Ask about alcohol over toxicity or alcohol withdrawal. Okay,
Mm.
so I need to ask what about the weekend? What about the last 3 days? Okay, okay. No, there is no alcohol. I don't drink alcohol.
If she used any medication like thyroxine or beta agonist.
No, vaccine. The vet appeared before. The vet, I mean, she is just will tell you that I take the COVID vaccine, doctor, 2 weeks ago. So it could be a vet. Okay, the a vaccine-induced immune thrombotic thrombocytopenia. This will be like vet and pulmonary embolism. Okay, so take care of the vet. And sometimes if you there is no vet and there is no pulmonary embolism, but just she had a history of what? Of COVID, like the case appeared recently. The patient has fatigue and muscle pain, and just she has this history of what? She got COVID. So this was a case of what? Of long COVID. Long COVID symptoms. Okay, just
Mhm.
myalgia, we have the palpitation, just fatigue, uh, this non-specific symptoms. Okay,
Okay.
so these are the causes of palpitation in basis. Okay, you can consider it like this: A, B, C, D, E, F. A, arrhythmia, anemia, anxiety, alcohol, and B, pulmonary embolism. C, cardiac, occum, aortic regurg, mitral, any valve. Once you have a valve, don't forget about infective endocarditis and involve caffeine and tea. Drugs, salbutamol, cyphilin, whatever. He will tell you about it. The only drug that you need to ask specifically is the illicit drug. Endocrine, like we said, thyroid hypo or postmenopausal carcinoma. And if, don't forget ever to ask about family history, fever, and vaccine. Okay?
Okay.
Okay, clear for you, Dr. Sarah, Dr. Mira, Dr. Abdullah?
Yeah, clear.
Yes, thank
Okay.
you. Clear.
Okay. Any question, Dr. Neha?
No, ma'am.
Okay.
No, ma'am.
I know that you are now in another, in a different world.
No, ma'am.
Okay. So this is how, approach the thing we discussed about the palpitation, to ask about the nature of it and alarming signs in cope. Then go, as we said, cardiopulmonary, endocrine, go about fever and pallor. Then go for to search for the BDF for any uh, illness, vaccine, illicit drug family history. And don't forget stress, alcohol, driving, by the way. I forget driving, really. We need to ask about driving in this patient.
Yes, if he has syncope, he should stop driving,
And if
right?
she is not in syncope, and she is, if
Mm,
even if she is not in syncope, she needs to
Mm-hmm.
stop for 4 weeks at least until we can
Oh,
find the reason. Okay,
okay.
so we need to ask about the driving also. Okay, this is for the palpitation. I hope you enjoy it. Is it easy for you by this way, or just to discuss
Yeah,
it and explain it?
it's, it's interesting. Like this.
No, it's
Okay,
easy way. Yes,
it's what?
it is easy way. This way is good.
Okay,
Thank you.
okay. Dr. Nia, okay this way?
yes, ma'am.
Okay, it's different from the classic way, because this is a mock.
Yes.
Okay, okay. Switch just this is the examination. If you want to take a slide for it, this is any examination. The general one takes systematic from the hand, vital signs, then random blood sugar, general look, hand, elbow, face, eye, mouth, neck, all of them, like we discussed. Then we will just focus on the pulse and the heart, plus minus the chest. And according to your case, in this case, this is a case of men too, so you go for the abdomen or for abdomen. You need to examine the scar very well, the thyroid goiter, the lymph node. This is the main issue. Then, if I have time, I go for the heart. I examine the heart, and then if I go time, I go for the chest. Okay, if I have time. Okay, people, clear?
Yes, clear.
Yes, ma'am.
Okay. So we finished today